Okay, everybody, welcome to our snow day makeup class. This is going to be a class to cover some of the material that we would have been able to cover had we not been snowed out. 3 out of the past 6 classes. If you enjoy this system and you think it helps you, let me know. Also, if you don't like it whatsoever, let me know. Because moving forward, there's a few different ways I might incorporate the online lecture capture into the course for the rest of the semester if people like it. I can review material that was confusing from prior classes. I can review material for upcoming tests, and I can also answer questions if I find that I'm getting a bunch of different questions from different people through email, or if you come to my office hours, and that way I can try and address things to the whole class in a way that I would otherwise be doing just for those people who are willing to actually reach out and send me an email or something. So, without further ado, why don't we get into what we will be covering for this online class. And bear with me if there's some hiccups along the way. This is the first time I've used this. It's pretty user-friendly, but we'll see if that works throughout the rest of the lecture. Okay, so in the prior lectures, we talked a lot about nature-nurture, and we talked about the extent to which you are influenced by your genetics or by your environment. And we all pretty much agreed that genetics must have a big influence, and that the picture with the environment is a little bit fuzzy. It's kind of hard to see the impact of specific environmental factors. That's why people, behavioral genetic researchers in particular, have identified non-shared environmental inputs as being those that are really impactful. And non-shared things are things that are very unique to the individual, very subjective ways that the environment might impact them. So in this way, a sibling might react to a Christmas gift of socks, being really, really happy, and the same event, me receiving socks, I might say, well, this sucks. I wanted a toy. So that's a simple example of how the non-shared environmental factors influence people differently. The thing that I want to address for this class is, at what point do you think you would actually be able to see the influence of the environment on your child? At what point do you think environmental input would actually alter the behavior of your child, and to such a degree that you would be able to notice it? You might think maybe once you're born, right? That makes sense. That's the first time that you as a child are experiencing the sights and the sounds of the world in a way that maybe an adult would, right? You can now see people. You're no longer in the womb. You can hear people talking to you, different people, right? There are different smells, different, you can touch people skin to skin. So maybe at that point, those environmental factors can actually exert a large influence. But what we talked about a little bit last class is, are there aspects of the environment even before birth that can have an impact? And what do you think they might be? Think for yourself. Take 10 seconds. What are some different environmental factors that could influence the development of a child prenatally? Exposure to some toxins that you're probably familiar with and you've probably heard about definitely fall into that category. What about what the mother eats? What about if the mother gets sick? Do these things have an influence? What about the type of neighborhood, if there's a lot of pollution? Do you think that might have an influence on the child? And do you think you'd be able to observe the effects of these types of events even before the child's born? That's the type of thing that we're going to be talking about in this lecture. I also want us to be thinking about this material not in a third-person theoretical type of way, because even if you don't have a child now, at some point you may want to have a child, and it might be important to know what types of things in the environment might have a negative influence or impact on the development of your child. Alternatively, you also want to know what types of experiences might be positive and might benefit their development. And in fact, right now there are tons and tons of products out there that are made just to try and benefit the prenatal development of your child. Things that, educational tools even, that you can use that promise to benefit the cognitive development of your infant, starting prior to birth. And I don't know if you can follow the link on this page, so I put it on this page as well with a little picture of one of these. It's called the Baby Plus, and I like to call it a baby boom box. This straps around the torso of the mother, and it projects sounds into the womb so that the child, while developing in the womb, can hear these. And it claims that it has cognitive benefits for the child. Interesting. Whether or not you believe this might have a positive effect on the child is one thing, and we'll take a look at some research at the very end of this lecture which might be able to inform your opinion about these types of products that promise to benefit the child prenatally. So if we're going to have a discussion about the types of things that can influence the development of a child prenatally, we have to have an understanding of the typical course of development prior to being born. So we're going to first talk about the stages of prenatal development and the important milestones during these stages. Then we're also going to talk about things to be wary of in the environment, things that pose a particular risk to the developing child before they're born. So we're going to talk about the negative aspects of the environment, and then we're going to talk about potential positive aspects of the environment when we talk a little bit about prenatal learning, things that we think might actually be able to benefit the child prenatally. Maybe not something like this. You may not need a baby boom box, but what, if anything, could you do to potentially help your child learn something prenatally? That's the topic we'll cover right at the end. So here's a handy chart that you can refer back to at any point that gives you an outline of the 3 stages of prenatal development that we're going to talk about. The first of which is the germinal stage, also called the period of the zygote, and it lasts for approximately the first 2 weeks following conception, first 2 weeks of gestation, another term I might use. Following the germinal stage is the embryonic stage, which lasts from approximately the 3rd week of gestation to the 8th, and from the 9th week on until birth is what's known as the fetal stage. And down here on the bottom of this you can see a chart of the different organ systems or different body systems that are developing at the different points within each of these stages. One thing I want to draw your attention to, because this is a big topic, this is a big bullet point and will appear on tests, I guarantee you this, the embryonic stage. If you're to focus in on that stage in particular, look at the number of immature bodily systems there are. At the beginning, as we'll see in just a minute, the developing child is nothing more than a ball of cells. By the end of it, basically all organ systems have started to, at the very least, started to develop. So when we get to the risk factors, things that can cause abnormal development, all of those, a general rule of thumb, are going to be have a maximal negative impact during the embryonic stage when those organs and organ systems are not yet well developed. So keep that in mind moving forward. Star that, write it down in your notes, bullet point. You'll see it again in this lecture, but you'll also see it when you are tested on this, guaranteed. All right. So let's first talk about the germinal or the zygote stage. Like I said, it's the first 2 weeks following conception, or the first 2 weeks of gestation. And the zygote stage starts right at conception. It ends when the zygote, or actually the blastocyst, has implanted itself, has traveled through down into the uterus and implanted itself into the uterine wall of the mother. That would be when the zygote stage ends. During this stage, there are a few important developments that happen. First of all, you go from one single zygote cell, one cell, a sperm and eggs fused together, to a ball of cells. So every 12 hours or so, the cells are going to double. And they just keep doubling and doubling and doubling and doubling and doubling, and eventually, right here, the second image you see, that's what's called a blastocyst. It's a hollow ball of cells. And this will travel down, and when it implants itself into the uterine wall, it actually starts to begin to differentiate. At first, it's all just identical cells. And when it starts implantation, the cells on the outside become the amniotic sac and placenta, and then cells on the inside, down here you can see, actually form what's known as the germ disc, and those are what become the infant eventually. So there's a differentiation between the cells that protect and provide nutrients for the developing child and those that become the child itself. So following the germinal stage is the embryonic stage, and as you can see here in the image, during this stage the child goes from that ball of cells that's implanted into the uterus to actually beginning to resemble a human. But still, even by the end of this stage, the child is only going to get up to approximately 1 inch long. So typically this is way too small to notice, which underscores the importance of being aware of those risk factors that we're going to talk about later on in this lecture, because if you or your spouse are unaware of a pregnancy and are exposed, it can have, like I said before, big impact, especially at this early stage. So it's important to be aware of this, aware of whether or not one is actually pregnant. There's additional cell differentiation that goes into this stage. It's not just the cells that form the amniotic sac and placenta and those that form the infant. There's a differentiation within those that form the infant. And 3 cell layers are going to develop. The endoderm is the innermost layer of cells, and these form sort of those innermost organs and organ systems of the human. So the digestive system and the lungs. The mesoderm is the middle layer, meso being middle, and this will form muscle, bone, and the circulatory system. And the outermost layer will form the outermost systems of the body, so hair, skin, as well as the central nervous system, and that's an important one. As you can see here, it's during the embryonic stage that the heart of the child actually begins to beat. So even early on, within the first month or so of gestation, the child is going to have a heartbeat, and you can actually see this when you start having an ultrasound. Also, the amniotic sac now is filled with fluid during this stage and is protecting the developing child. So here is what the child will look like at the end of the embryonic stage, or maybe beginning of the final stage, the fetal stage of development within the amniotic sac. And the importance of the amniotic sac is that it's basically a cushion, it's a buffer It surrounds the infant, it protects the infant, it provides a constant environment, a constant temperature that is ideal for the development of the child over the remaining several months of development. On this diagram here, you can see the umbilical cord, which is full of blood vessels that carry blood from the placenta out here in the uterine wall to and from the child, him or herself. And right here, this is, as you can see, the placenta itself. These finger-like projections are called villi, and these villi are where the transfer of blood, nutrients, waste material is happening between the blood supply of the child and the blood supply of the mother. Now, the mother's blood never actually comes into contact with the child's blood, but the nutrients, they are able to cross between the blood supply of the mother and the blood supply of the infant via these villi. So there's no actual physical connection. It's not pumping blood in one vessel and out another through the umbilical cord, but there is exchange of material between the two blood supplies. So when it comes to risk factors, we're going to talk, there are some diseases that might also be able to be transferred to the child in this manner, but it's not a physical connection between one blood supply and another. It's a transfer of microscopic nutrients and waste particles between the villi and the placenta. And the final stage of prenatal development is the fetal period. This is probably what you're most familiar with. This is when the child actually begins to look very much like a child. You can see at the end of the embryonic period, beginning of the fetal period, there are human-like features, but by the end of the fetal period, right before birth, you have what looks like a neonate, a newborn child. What's happening during this period, primarily, there's a great deal of organ maturation. So those organs which have begun to develop during the embryonic stage are now getting to maturity. They're coming online. They're able to actually process information and carry out functions even within the womb during this fetal period. And the child's also putting on an enormous amount of weight. Again, while it's developing, the amniotic sac is able to protect it, but it needs to have its own sort of baby fat on it to be able to insulate it and protect it once it is outside of the womb, and it's during this period it's putting on that weight. Gentlemen, I regret to inform you that prior to approximately the 3rd month of gestation, you were female. That is correct. Men and women show no differentiation until approximately the 3rd month of gestation, and that's when there are physical differences in terms of the development of the genitalia. So, I'm sorry, gentlemen, you were once women, and if you need to talk to somebody, I can probably put you in touch with a therapist. My office hours aren't for that kind of thing. Around the 4th month, that's when the musculature and the weight of the child is developed enough such that the mother can actually feel the child moving. So that's when you might be able to actually put your hand on the belly, feel a kick, kick, kick. About the 4th month is when that's going to start. And around the 5th or 6th month, the child starts to become covered in a slippery substance called vernix. And it's vernix that's going to sort of lubricate the child for when it eventually is actually born and needs to pass through the birth canal. So even 3 months or so prior to being born, it's sort of preparing itself to be born, and it's getting coated in this lubricating substance. It's important that it is coated this early because there are complications that can actually sort of speed up the process and influence the birth of the child, making it, a preterm child. So at a certain point, at approximately 22 weeks of gestation, the child, if it is born that early, there's a possibility of survival. And this is what's called the age of viability. Even though there is a possibility of survival, there's a darn good chance a child born that early will have long-lasting deficits in their development. But due to modern medicine, children can be born 16 weeks or so preterm and still survive, which I think is pretty amazing. The problem with being born this early, this much preterm, is you can see here on the right, there's still a lot of development happening in different organs and different organ systems. So a child born that early might have trouble breathing, so it might need to be hooked up to a respirator in the neonatal intensive care. And because they will probably be very underweight, they also have difficulty regulating their body temperature because they won't have the baby fat necessary to do that. So there are definitely developmental risks to being born that early, though it is possible to survive. Also, the nervous system of the infant is undergoing a great amount of maturation. It's already, basically throughout the entirety of the infant's development prenatally, there is nervous system development happening, but it's really during this fetal stage and during the end of the fetal stage when the cerebral cortex, which is the part of the brain that's responsible for the highest cognitive functions like memory, attention. It's during the end of the fetal period when this is really starting to mature. And so it's important that there's adequate nutrition, especially during the fetal period, for these higher cognitive functions. So at this point, we have a pretty good idea of what typical prenatal development looks like when certain systems are starting to develop, when certain milestones are being hit. But if we want to understand how different environmental factors can influence the actual learning of the child prenatally, we have to have an understanding of what their behavior is like typically. From a behaviorist standpoint, learning is nothing but a relatively enduring change in behavior caused by some experience. We see already here on this chart, central nervous system is up, it's running during the fetal period. So there are senses that can experience the world that the infant is developing in, but we need to know how it's typically behaving to understand whether or not the events happening around it are able to influence its behavior. So how is it typically behaving? Well, the prenatal child is behaving very similar to what a neonate would behave like. A newborn infant goes through the similar type of activity cycle that a fetus will go through. There will be periods, short periods, bursts of high activity, a lot of kicking, tossing and turning, and then long periods of rest, several hours of rest, where the child will actually be sleeping within the womb. You can see right here, maybe the mother is sleeping as well. Maybe she's blasting some Enya. I don't know, but she looks pretty tranquil, and I imagine that her infant, if we're talking probabilistically, more often than not, the developing child's also going to be sleeping. So, like I said, the behavioral profile is already going. The same type of behavioral profile that the child is going to exhibit after being born. So you can see a little bit of maybe what the genetic input has done for the child. It may have predisposed it to be more or less active. So you can get a sense of the type of activity that your child's going to have if they're constantly active. Well, not constantly, but if they're active a lot more frequently than you would anticipate for a fetus, then they're probably going to be highly active as well as a young infant. So that behavioral profile is already being set up during the fetal period. And if during the fetal period there's all of that central nervous system development, what that means is that there's development in the senses. Now, sight, the child's not going to be able to see much light in the womb. So there's not a good deal of development in terms of the child's ability to see, but the amniotic fluid that surrounds the child actually does have taste and smell to it. So the child can actually taste and smell the environment it's in the amniotic fluid, and it will actually react to changes in the mother's diet, because changes in the mother's diet will change the amniotic fluid. So it's interesting, you can see differences in behavior in the child due to differences that in the environment that the mother is in. So there is a little bit of an influence you can see through the senses on behavior. Another big one, however, is sound. The amniotic fluid, it acts like an amplifier for sound. Sound travels better in liquid and through solid than it does through air. So when that sound hits the amniotic fluid, it's just resonating for the infant to hear. So the infant, we know, in the fetal period, it can learn and remember familiar voices and familiar sounds that it hears. So it will react to the mother's heartbeat. It will react to people that it hears often, like the mother speaking or the father speaking. It might become more active when it hears these sounds, showing maybe it's a little bit excited, maybe there's a little bit of emotion to it, but it will change the behavior. So there's the general activity cycle. Periods of high activity and long periods of rest, but there are environmental inputs that through the senses of the child during the fetal period, we can see that these are affecting the child's behavior from that normal high active and long rest cycle. All right, so at this point we have a good idea of the typical development of a child prenatally and the typical behavior that they exhibit during that fetal stage, when you can start to actually notice their behavior. So now we're going to talk about different risk factors that can derail that development and what types of effects these risk factors can have on the child. And there's going to be two general classes of risk factors we're going to talk about. They're going to be overarching general risks, and then we're going to focus in on specific toxins in the environment, what are known as teratogens, that we know have negative effects on the developing child. One of the major general influences, general risk factors on child development is maternal nutrition. So deficiencies in maternal nutrition for the mother can result in different abnormalities for the prenatal child. Deficiencies in the mother's intake of folic acid can result in a condition known as spina bifida. Now, spina bifida results when the neural tube, which is the beginning of the central nervous system of the child, when it fails to close properly, as the child develops further and further prenatally, the spinal cord will actually poke through where the vertebrae would be otherwise. So those vertebrae never really close. The spinal cord is able to sort of bump out. The risk for this is highest during the first 3 months. It's during these first 3 months that early central nervous system development is happening, and those early cells that form the central nervous system, the neural tube, are closing during that first 3 months. It's also very difficult to know during the first 3 months, if it's unplanned, whether or not one is pregnant. So there's a big risk, especially if somebody typically doesn't have a lot of folic acid in their diet. This can be particularly damaging. The result of this is lifelong physical disability, difficulty moving. It can be mitigated if caught early enough with prenatal surgery. It's risky to do, but it can be done. But again, if during these first 3 months a mother is unaware that she's pregnant, it might develop further and further, and the surgery may not be as successful. Another condition that can result from deficiencies in maternal nutrition is rickets, and this is linked to vitamin D. You also get vitamin D through exposure to the sun. So here in New England, right now it actually is sunny as I'm saying this, but imagine later on this weekend when we get hit with a blizzard, it is not going to be particularly sunny. So it's difficult to get vitamin D when there isn't a lot of sun as well. So it can be a nutritional as well as a sort of an environmental deficit. And the result of rickets is it's a physical deformation, but it can also result in complications during the birthing process. So nutrition, that's a risk factor. How can you combat this? How can you ensure the proper development of your child if you are going to have a child? Adequate nutrition, and if you can't get adequate nutrition, then at least supplement what you're getting with a multivitamin or supplements, especially with folic acid and vitamin D, because we know these are two nutrients that specifically can, if deficient, result in long-term physical disability for your child. Two more maternal factors that are general risks for the prenatal child are the amount of stress she's experiencing as well as her age. Now, I think the book says stress in general can be harmful, and this is true, but it's particularly bad if the stress is caused by or in some way related to the pregnancy itself. If the mother is stressed about the pregnancy, that's when the effects tend to be the worst. And what are the effects? Well, a mother who's stressed is putting her child at risk for being born low birth weight, as well as preterm delivery. So these are effects on the child which can be mitigated after being born if there is therapy, but a general rule of thumb is the lower the birth weight, the more difficult it is to put that child back onto a good developmental track. Now, one issue with maternal stress linked to pregnancy is that, well, okay, if there's a lot of stress about the pregnancy, could it be caused by complications with the pregnancy? So if you're talking about having a negative effect on the child, it's hard to know, is the pregnancy causing the stress or is the stress causing difficulties with the pregnancy, if you understand what I'm saying. If you're having a difficult pregnancy, it's probably going to be a stressful experience, and it may start to sort of feed upon itself. You know, it might initially start to be a little bit difficult, then become more stressful. That stress might make the pregnancy even more difficult, and further and further it goes. Additionally, both very, very young mothers and older mothers can be putting their children at risk, and it's not as cut and dry as that. There are particular reasons why very young mothers and older mothers might be putting their children at risk for different negative developmental outcomes. If a mother is very, very young, a teen mom, for example, often, and I say often to emphasize that it's not always, and this isn't a 100% thing. This is just statistically speaking, on average, younger mothers tend to have lower socioeconomic status. They tend to more often be single parents, maybe not very well educated, and they may not have stable employment. And it's not the age itself, but it's this slew of other factors related to being a young mother that often can have a negative impact on the development of the child. The picture I'm painting is a little bit bleak, and again, it's a probability thing. It's not every individual is going to, if they have a teen pregnancy, have a child with any kind of developmental delays. But if a teen mom or a young mother does have some other sort of wider social support network, grandparents or other family members that can help manage the child care while the mom is dealing with the other factors such as school and work and providing for the child. If they have somebody who can help with the day-to-day care, that tends to mitigate the effects of age that we tend to see. And what is the effect? It's just delays in development. If we go to the opposite side of the coin, older mothers, and by older I don't mean old, I mean older being somewhere in the late 30s and above, they tend to have children who are at larger risk for genetic disorders, and in particular Down syndrome. Now, a higher risk doesn't mean a high risk. A higher risk just means higher than normal, and the normal risk is very low. So it's still a pretty low risk, and older mothers still provide high quality care. It's not like a mother at the age of 40 can't keep up with an infant. That's not the picture I want to paint either. There's just a higher risk of these genetic disorders, as well as potential risk of miscarriage associated with being a mother at the age of 35. So for you, if you would like to have a child, you just sort of have to be aware of these factors. So now I'd like to talk about some specific risk factors, things that pose a threat to the development of your child prenatally. These are known as teratogens. Teratogen is an agent that causes abnormal prenatal development. So something that is specific that we know can have a negative impact on the developing child prenatally. And these take the form of diseases, drugs, both illicit and legal drugs, and there are also specific environmental hazards or environmental toxins that are known to, if exposed to the mother, they are known to be able to cross over the blood barrier and influence the child and have a negative impact on their prenatal development. In talking about the diseases that can harm the prenatal child, most of them do not have an effect. Most diseases like cold or the flu, if a mother gets those, they're not going to be passed on to the child, and they're not going to have a negative impact on their development prenatally. So in the vast majority of cases, if you have a cough, if you have a sniffle, there's going to be no harmful effect whatsoever, so don't freak out about getting a cold if you're pregnant. But there are some diseases that are known to affect the child prenatally, to be able to be passed on and have negative influences on their development. And they can be passed on in two ways. First of all, they can be transferred right through that connection with the placenta. the connection of the mother's blood supply with that of the child, and they can also be passed on by contact with the lining of the birth canal while the child is being born. So when they're being born, they're no longer enveloped in the amniotic sac, they're no longer protected by that, and they can come into contact with the mother, the lining of her birth canal, and actually through that skin to skin, the sickness can be passed along. So diseases that can harm the child and can be passed along through the blood supply with the mother include AIDS and syphilis. With AIDS, if the child contracts it, they can have infections because they are immunodeficient. It can result in neurological disorders and also death. Syphilis, if passed on to the child in this way, can cause damage to the nervous system as well as to the teeth and bones. They can have physical abnormalities as well. If you're a mother and you have one of these conditions, it's still not highly probable that the disease will be passed along, but obviously it's much more probable than if you don't have these diseases. So obviously talk to a doctor about this, but the effects, if passed along, are these that you see written down here. AIDS can also be passed along with contact with the birth canal during the birthing process, and another one that can be contracted in this way is genital herpes. And the major risk with passing along genital herpes is that it can cause brain damage. The brain can become inflamed and be damaged in that way and have neurological difficulties. And it can also result in an enlarged spleen, so other organs can be affected, and the blood might not be able to clot as well. So if the child gets a cut or something, it might be difficult to stop the bleeding. A good rule of thumb when talking about the effect of maternal drug use on the developing child is that illicit drugs, they cause widespread developmental delays. We know marijuana, we know cocaine, and we know heroin can do this. Specifically, marijuana may also affect the child's motor abilities, and cocaine and heroin might result in a highly irritable child. So the child just might be more sort of reactive to the environment. And this irritability, a lot of times you see it characterized as sort of being a withdrawal type of thing, where they were addicted to the substance and now they're born, they don't have it in their system, so they're irritable because of it. But there are legal drugs. So even if Dr. Mario here prescribes drugs or you're able to get drugs from a pharmacist, just because it's legal doesn't make it good for the child. And you probably can think of at least one or two drugs that are legal that you know have negative effects on a child prenatally. Some of the most notable ones are nicotine, so cigarette smoking, that can result in very low birth weight children. Aspirin can also result in cognitive deficiencies as well as motor deficiencies. Accutane, which is a drug I don't think is prescribed frequently now, but used to be prescribed more often, and it is it's an acne medication. Also results in cognitive deficits as well as abnormalities with the eyes and with the ears, so the senses are also affected. And probably the biggest one is alcohol. Alcohol can result in what's known as fetal alcohol spectrum disorder, which is just a milder form of fetal alcohol syndrome. So why is all of that bolded? Well, because it's alcohol that is the leading cause of developmental disabilities in the U.S. It's because many times mothers involuntarily or voluntarily even expose their children to alcohol while they are pregnant. And it's unknown how much is enough to cause damage. And that's what the real risky part of it is. For some children, prenatal exposure, even in moderate amounts, might not have an observable effect, something that you can say, yes, this is damage. But for others, even 1 drink, 2 drinks at the right point in prenatal development can have terrible long-term, lifelong consequences. And then these consequences are in the form of great cognitive deficits, retarded meaning slowed or abnormal growth and development. So there are actually very stereotypical abnormal facial and body features that are associated with fetal alcohol exposure. And if you can click the link in this hyperlink here, go ahead and do so. It's a 10-minute or so video I think is pretty impactful that shows a mother talking about her son's struggles with fetal alcohol syndrome. One of the most difficult things is it's entirely preventable. It's just alcohol. You don't have to drink it, but a lot of times, again, those first couple of months, a mother might not know that she's pregnant and might involuntarily expose her child to these substances. And alcohol is one that causes a great deal of developmental disabilities. In case you can't click that link, here it is. You can copy and paste it or just type it in manually. And I also put a picture. These are what the stereotypical features I was talking about, the facial features associated with fetal alcohol syndrome look like. So small eye openings, smooth philtrum. Now this is just that sort of divot between the nose and your mouth, and a thin upper lip as well. So right sort of at the center line of the body, down the middle of the forehead and down the whole rest of the body, there tends to be abnormalities, physical abnormalities, and you can see it in the eye and nose and mouth. So I encourage you to watch that video, or at least watch some of it. Take a look at it. It's moving, and I hope it'll show you what the impact of fetal alcohol syndrome is on the family, not just on the child, him or herself. So moving along, there are additional hazards that are in the form of pollutants that you might expose a child to prenatally through taking in food or water, or even just in the air you breathe. So these can be associated with the neighborhood you live in, and you may not even know it. So that's why these ones are particularly damaging. You've probably heard of several of these. Lead is one that's not just damaging if a child eats the lead paint chips, it's damaging if the mother is exposed to lead while pregnant. It results in developmental disabilities, may result also in spontaneous abortion and stillbirth, and where the mother is most likely to come into contact with lead is in the water. So good to get it tested. If you know you're going to be pregnant, would like to become pregnant, make sure there is no lead in the water. If there is, then find an alternative water source, filter the water, do something, get the lead out. Not just a fun saying, meaning go fast. Also, get it out of the water, do not expose your child to it. Mercury is an element that can be found in fish. They may eat things and have mercury, and then you can eat the fish and you get the mercury. It's the same reason you don't want to be breaking open old thermometers that used mercury. It can seep into the skin, cross over into the child's blood supply, and result in large-scale developmental disabilities, including retarded or slowed growth, and cerebral palsy, which is a neuromuscular disorder. So with great physical disabilities that last a lifetime. PCBs are industrial chemicals found in industrial waste, and this can get into the groundwater if you live in an area where they're not quite going along with Johnny Law. when they are disposing of the substances, and this can result in large cognitive deficits, especially to those higher functions associated with the cerebral cortex, memory, verbal ability. X-rays also can result in retarded growth, as well as leukemia, which is a form of cancer. And listeria is a bacteria that's found in deli meats, and this is why you may have heard that it's not good for a pregnant woman to eat deli meats. It's because there's a bacteria that to us is harmless, but to a developing child in the womb can result in stillbirth, premature birth, perhaps even death, large-scale central nervous system damage, and potentially infection, which in and of itself will lead to additional difficulties. So here are some specific environmental toxins to be aware of and typical places where a pregnant mother may come into contact with them. So an additional thing that down the road, I know right now you're in college, you may not be thinking about it. Down the road, it's important to be aware of these as well as the other risk factors in terms of disease and drugs and maternal nutrition. It's important to be aware of all of these to try to protect the developing child to the best of your ability. Some general facts about teratogens or rules of thumb. Genotype matters. What that means is that the genes that you pass on to your child may predispose them to be more or less sensitive to some of these teratogens than others. So that's why, for example, some children could be exposed to moderate amounts of alcohol and show no cognitive deficits, no physical abnormalities whatsoever, and another child might have a genotype that is very sensitive, that makes them very sensitive to the effects of alcohol, and if exposed to even a small amount, might result in negative cognitive and physical deficits. So it's hard to know who will be more or less sensitive, but it's known that because of genetics, some people are. Also, the effects of teratogens depend upon the point at which the child is in their prenatal development. So I said it early on, I'm going to say it again. General rule of thumb, during the embryonic period, if a child is exposed to teratogens, it's going to have the worst consequences. And this is because most organ systems are not mature or are just beginning to develop. So if they're already put on the wrong track from the get-go, it's only going to get worse from there. Additionally, the impact depends on dose. The general rule of thumb is more exposure to the toxins will result in worse outcomes for the child. So the more they're exposed to alcohol, the more they're exposed to maternal deficiencies in nutrition or maternal stress, the worse the developmental outcome will be for the child. The more likely they are to have lifelong deficits. And one thing that makes the study of teratogens difficult, you can't ask a mother to expose herself to mercury to test its effect, for example. You can't ask a mother ethically, here, why don't you drink alcohol throughout your pregnancy so that we can see what alcohol does to a child. So there's no way to really isolate the effects of teratogens. You sort of have to look naturalistically at the different types of teratogens that exist in people's environments and the different teratogens mothers have exposed their children to, and assess what the potential deficits could have been due to those. And it's difficult because in many instances mothers, intentionally or not, expose their children to many teratogens throughout the course of their pregnancy. Typically it's, a mother might be in a bad neighborhood or have low socioeconomic status. For example, They may not be able to get the nutrition they need. They might also be exposed to bad water supply. They may also not know they're pregnant and smoke for a little bit of the pregnancy. So these factors, these teratogens, which all pose risks for the development of the child prenatally, often occur together. Many of them often occur together, and it makes it hard to know what the specific impact of any individual teratogen is. So it might seem a little overwhelming at this point. I mean, it seems like you can't even take a step without exposing your child to teratogens. What the heck? What are you supposed to do? How in God's name do you know if your child's developing appropriately? Are you just going to wait the 9 months and say, well, let's hope everything's okay? Or are you going to try to catch it early, try to mitigate the damage, and try to prepare for dealing with the potential challenges that there could be if your child's been exposed to any of these? So you'll want to be able to hopefully diagnose any developmental difficulties there could be prenatally so that you can be better prepared once the child is born. How do you do this? Some of the typical ways of doing that are through ultrasound. So blasts of sound image what the child looks like in the amniotic sac. You can generally start to see development at about 4 to 5 weeks. Again, before that, you're looking at a child that is very, very small, not able to be seen with the naked eye. And with this method, what it allows you to be able to see are gross physical abnormalities. You can see if the child is positioned in a bad way such that it would make delivery difficult, or if, for example, maybe the umbilical cord is wrapped around its neck. So you can try to plan for a different way of giving birth, for example, a cesarean section, which we'll talk about in a later class. Amniocentesis is a technique that can be used to screen for genetic disorders. And with this technique, it can be done as early as 16 weeks. And it's a needle is stuck in that takes a sample of the amniotic fluid. And the amniotic fluid will have dead skin cells from the developing child in it. And you can take those cells, you can then isolate the DNA and look at the genotype, or what genetics they have, to see if maybe they are developing with something like Down syndrome or another genetic disorder. And then from there you can meet with a genetic counselor and plan for the best means of treatment. An additional way, if you think you are at particular risk for having a child with a genetic disorder, an additional way to screen for this earlier than 16 weeks is a method called chorionic villus sampling. And this is when a sample of the placenta is actually taken from the mother early on. It's good in that you can screen for the disorders earlier than at 16 weeks, but it's much riskier for the mother to do this. And I'll show you why in a couple of slides. You'll see what it actually looks like to take that sample of the placenta. So here's what an ultrasound looks like. You've probably seen these in movies. Maybe you have seen ultrasounds of yourself when you were developing. If you have a kid, you've probably also seen ultrasounds of your own child. So again, it's grainy. You don't see much detail, but you can see the general position of the child and some gross physical abnormalities if they exist. And this is why, it's not a very high quality image. That's why maybe sometimes the doctor might say you're having a boy and it's actually a girl. They might just see some sort of artifact on the ultrasound and that's not actually the male genitalia, and then you'll be surprised at birth when you have painted the room in a certain way and you need to repaint. And for amniocentesis and chorionic villus sampling, here's how these two techniques work. In amniocentesis, you can see here on the left, a needle is just stuck in, doesn't puncture, doesn't rupture, I should say, the the amniotic sac. It just punctures in, very small, takes a small sample, you're done. In and out. You watch it with an ultrasound scanner so that you know that you're going to be a safe distance from the fetus, but you just go right in, take up that sample, and you're done. Through chorionic villus sampling, it's a lot more risky because what you're doing is actually putting a catheter up through the birth canal into the uterus to get to the placenta. And in the placenta, you're going to have a mixture of the mother's and the child's own cells. And this is risky. I mean, you can see going in that way, you could cause an infection, you could scrape and cut the mother, and you could also actually hit the fetus as well, but it's particularly risky for the mother. So unless there's good reason to suspect that there is potentially a genetic disorder, it's probably best to go with amniocentesis over chorionic villus sampling. Okay, so we've talked about what's typical in development, what's typical of behavior of the fetus, what are some risk factors to be aware of during the course of your child's development prenatally. And we've also talked about some wacky instruments that are out there to try to benefit the child's learning prenatally. And we know that a child can identify familiar voices. Can the child learn more complex information than just a voice or a sound? Can it react differently to something a little bit more complex than that? Well, in 1986, some particularly genius researchers, DeCasper and Spence, conducted a study. They had 16 pregnant women with their children in the fetal stage of development come into the lab, and they read a few different stories, short children's stories, something like The Cat in the Hat, for example, Horton Hears a Who, and The Lorax. They read those and recorded them, and then they were instructed by the researchers to, for the rest of their child's development before being born, to reread one of those stories twice a day so that their child would be able to hear it in the womb. Fair enough. Within days of being born, the researchers wanted to test the memory of the story itself. They wanted to test the infant's memory of the story. Does anybody see a problem with that? How the hell are you supposed to know if a newborn infant remembers a story? I wouldn't have been able to figure this out, but in 1986, these guys came up with a particularly ingenious design. They had a non-nutritive nipple that the infant could suck. Sucking is a behavior they can exhibit, and they do exhibit. Okay, and it's one they have some control over. So they were thinking maybe if they could have the infant suck for a particular amount of time and it played the story, that maybe they would, if it was familiar, maybe they would continue to try to hear it. And if it was unfamiliar, would they behave differently? So they wanted to see if they could distinguish between a familiar story read by the mother and an unfamiliar story that was also read by the mother. So that's why they had these stories recorded earlier on. So what happened when the infants were exposed to the recordings of the stories from their mother? Well, infants would only suck the amount required to hear the familiar stories, but not for the unfamiliar stories. So if they sucked the 3 seconds, 2 seconds, or whatever random number they were supposed to, and they heard an unfamiliar story, it didn't change their behavior. If they did that same behavior, sucked for 3 seconds, 4 seconds, whatever the amount was set at, and it played Cat in the Hat, and that's what their mother had been reading, well, when it was done playing Cat in the Hat, they would do it again, and they would do it again, and they would do it again. And this showed the researchers that these children not only distinguished the sounds of the mother's voice, but could actually remember something about the story itself, something about maybe the cadence of the mother's voice telling that story, or the melody of the story itself, that the child was able to identify as early as just a few days after birth. And what's even more interesting is if they were exposed to a story that was read by a different mother, they could still identify the story. So there were some infants who were, instead of having the mother say the story over and over again, they would have the recording of a different mother play the story to the child. So it wasn't the mother's familiar voice that they were sucking to, it was the story itself. So, pretty ingenious design. Didn't matter if the story was read by the mother or a stranger throughout those last couple months of development. After a few days in the real world, outside of the womb, they would be able to distinguish between a familiar story, not just the voice. So they're learning something more complex prenatally than just, this is my mother's voice. They're learning something we don't really know, perhaps the music of the story. And this is reflected in their memory, and you can see it in their behavior. So that's all for this particular lecture. Feel free to watch this over and over again. Share it with your family and friends. If you have any questions, again, feel free to always contact me. You can always come to my office hours. Let me know if this is something that you enjoy or if it's something you don't enjoy whatsoever, so that I can hopefully refine it and use it for the rest of this semester, and hopefully help your learning of the material. All right, I'll see you on Monday, assuming that this blizzard is at least able to be cleared by then. Otherwise, enjoy another snow day. Take care.